Hello, welcome to my channel Eye Opener. Coronavirus India live update. New Covid-19 cases highest daily increases so far. Coronavirus India lockdown news live update. Maharashtra reported 55,469 cases on Tuesday, while Chhattisgarh scaled a new peak of 9,921 cases. Karnataka and Uttar Pradesh and Delhi reported more than 50 cases each. Of India, total Covid-19 case hold 1,28,01,785. There are now 8,43,473 active cases. At least 630 deaths were reported on Tuesday, taking the toll of 1,66,177. About half of these were from Maharashtra, Punjab, Chhattisgarh, Uttar Pradesh and Karnataka, where other states which reported large number of deaths. The center on Tuesday said India COVID-19 cases were spreading faster than last time, and the next 4 weeks could be critical in the controlling the second wave of the diseases. Dr. V.K. Paul, who had India COVID-19 task forces, said people participation could be vital. Aimed the surgeon in infection, Delhi has imposed night curfew from 10 p.m. to 5 a.m. till April 30. Pune is facing a acute shortage of intensive care unit and ventilators, and active cases in the Mumbai police force has more than doubled in the last fortnight, rising from 155 on March 22 to 408 till Monday night. Delhi has COVID-19 cases across 5,000 AIMS chalks out new plan. Chhattisgarh imposed night curfew from 10 p.m. to 5 a.m. The Chhattisgarh UT administration has imposed night curfew in view of the increasing COVID-19 cases in the city. The curfew will become into the force from Wednesday from 10 p.m. to 5 a.m. Keeping in the view the rapid increases in the number of COVID cases, a decision was taken in the war room. Enforce night curfew from the 10 p.m. to 5 a.m. every day. No gathering, no parties, no initial activities, etc. will be allowed during the period. The restaurants will also be required to close by 10 p.m. The night curfew will be reviewed in the case of the situation improve. Himachal Pradesh puts cap on the social gathering. The Himachal Pradesh government has decided to restrict marriage ceremony gathering to 50% indoors and 200% outdoors in the order to control the spread of COVID-19. In case of funeral too, the maximum gathering now allowed is 50, and Chief Minister Jai Ram Thakur said the government has also decided to postpone the Yatra, which was scheduled to launch on April 15 as the part of Golden Jubilee of statehood celebration. Gujarat HC permisses to remain closed from April 10 to 14 for sanitizing. The Gujarat High Court said its premises will be remain closed from April 10 to 14 and Rusticate will be closed on April 12 for sanitizing. The court also suspended the parties of publishing 48 hours in the advance. Meanwhile, the Constitution Court of State also direct the physical functioning of lower court and tribunals in the 5 districts. Ahmedabad, Baroda, Gujarat, Rajkot, Jamnagar shall be suspended and judicial working shall be carried out only through the virtual online medium for the long period 10 days from the April 7 to 17. Subordinate court in this 5 districts, however, been permitted to take up matter physically which are either bound up already scheduled for compromise between parties or the compounding of sentence. For remaining district, it has been directed that while they continue operating physical, the working hour must be limited with 2 hours in the first season and the 2 hours in the second season, as well as limited staff with only 50% operating each. The decision to be curbs on the lower judicially physical functioning came from a standing committee meeting of the High Court was held Tuesday. It was noted by Chief Justice Vikram Nath that each day COVID cases are being reported among the judicial officers across district of Gujarat. Next 4 week critical for India COVID-19 situation, say center. The country is currently witnessing its second wave of coronavirus infection and survival states have imposed restriction to curb the spread of diseases. The central government has said the next 4 weeks are critical for the country to control the diseases. Simple tips to prevent the spread of COVID-19. Wear a mask. The WHO state that masks are a key of measure to suppress transmission and save lives. They should be used as a part of comprehensive do-it-all approaching, including physical distancing, avoiding crowded, close contact setting, good ventilation, cleaning hand, and or more. Depending on the types of masks can be used for the other protection of health person or to prevent onward transmission. WHO state masks must be worn in the area where the virus is circulating and crowded setting, where you can at least 1 meter from others, and in the room with a poor or unknown ventilation. It's not always easy to determine the quality of ventilation, which depends on the rate of air changes, recirculation, and outer fresh air. So if you have any doubt, it's safer to simplify wear a mask. Google has also put out a list of preventive measures that can be taken in the second wave of COVID-19 in India. Cleaning your hand often. Use soap and water or the alcohol-based hand rub. Maintain a safe distance from anyone who is coughing. Wear a mask when physical distancing is not possible. Do not touch your eyes, nose or mouth. Cover your nose and mouth with your band or elbow or a tissue when you have cough or sneeze. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek medical attention. One must know all the facts, take appropriate precaution and follow the advice provided by the local health authority so as to prevent the spread of COVID-19.